House Calls, sponsored by Roper St. Francis Healthcare.
A decade ago, a hip or knee replacement meant at least 3 to 4 nights at the hospital. But Dr. Patrick Murray says today, some Roper St. Francis Healthcare patients get to go home the same day as their surgery.
There's several things that have evolved over time that have made the recovery process much quicker. Pain control is a big part of it. By using spinal anesthesia, patients usually feel much better later that afternoon than had they had general anesthesia. We've gotten more proactive and aggressive with physical therapy, so instead of letting the patients sort of lie in bed for a couple days, we get them up right away. Patients are going to get a better night's rest if they are able to go home right after the surgery or later that day. As soon as you can get home, you can get up walking around the house. The faster you can get walking, the faster your recovery will be, the less likely you're going to have other complications.
For more information, call 843-402-CARE or visit rsfh.com.